And we've also talked about the antibody testing and the seroprevalence studies. We're going to have our first big shipment of antibody tests on May 1st at the state lab down in Miami, based on what the Surgeon General's estimate. We also have other tests coming in, both from the federal government and some from private companies. But those antibody tests will be very helpful because if you have healthcare workers and they have the antibodies, then you know that they're at lower risk at that point for infection. If you are able to do a study about the society as a whole, determine what percentage has antibodies, that gives us a sense of how the virus has moved through a given community. The Miami study that was done suggested that they had, at the time, 10,000 documented cases, and it suggested that the antibodies would probably be about 160,000 people in the community already had the antibodies. And so that would suggest it was more widespread than people thought initially. Also suggests that the hospitalization and fatality rates are much lower than what we have just based off the documented cases. But I think it's important to know in communities throughout Florida the prevalence of antibodies, and then we of course will use it for staff at long-term care facilities, because if you do have staff in a nursing home that has the antibodies, then that offers a level of protection from the for the residents.